A new approach to healing. Joining me is Allie White with QC Kinetix. Thank you so much for having me.
I'm so happy that you're here. You're in our office. You get to experience the QC Kinetix that I love and get to work in every day.
So I'm so interested in this. What is QC Kinetix?
So QC Kinetix, we are a non-surgical approach to joint relief and just other musculoskeletal pain areas. So we really dive in to make sure that our patients can be treated more in that non-invasive approach, because we know surgery ultimately is very invasive for patients. It can be very long time for healing. So we wanted to come up with an area of medicine and really dive into regenerative medicine to treat our patients.
And can you elaborate a little bit more on what regenerative medicine is?
Yes, absolutely. So regenerative medicine is really cool. So anyone that likes to nerd out over the science like I do, it is an area of medicine that takes what your body has, so autologous, meaning from you. It takes what you have, and what we can do is we can harness it in a way that your body can no longer do. So just a couple examples. There's a hot topic in medicine right now. It's called platelet-rich plasma, also known as PRP. So that's what we do here as well, along with other treatment areas and treatment modalities. So with that, we take what your blood has, so the cells from your blood, we take your blood, just like a normal blood draw, we take that into our lab, we spin it down, we take the cells from that are needed for healing, and we actually re-inject it into your area of pain.
How does this type of medicine differ from traditional medicine?
Great question. So it differs from traditional medicine in a ton of different areas. So if we think about the traditional pathway for patients right now, you have a steroid injection. Steroid injections just mask the pain. They don't bring a healing response. They actually dampen your immune system so your body can't do what it naturally wants to do. From there, patients just tend to get worse. Then you have your opioids. We also want to get patients off of opioids, knowing that the opioid epidemic is so large right now and how effective it is for patients. And then ultimately there's surgery. So surgery is a permanent decision. There are effects from surgery that can be really difficult for patients. The healing time can take a very long time for those patients, and then just the downtime as well. So for us, we differ from traditional medicine. Hearing all of those things of what you need to do in traditional medicine or getting an injection with us from your body's own cells, I would take the regenerative medicine approach.
Yeah, that sounds so interesting. So why QC Kinetix?
Why QC Kinetix? That's a great question. So for me, it's the patients. Our patients are the reason why. They come through our doors, we get to learn all about them. They bring us their why, and we help treat that why. So normally you go see your physician or your PA, NP, and the burden of healthcare, they can't get to learn who their patients are or why they're coming to see them. We can at QC Kinetix. So you may be coming for your knee pain, but what is that why behind your knee pain? What do you need to get back to doing? That's what I love about QC Kinetix, because that's what we're doing for our patients.
Now, who qualifies as a patient?
It's a great question. A lot of people. So we don't have a patient population that we don't really treat. We see everyone from younger patients all the way to patients in their 80s, 90s wanting to reclaim their independence. We see patients with injuries. We see patients post-surgery. We see patients with chronic disease states such as osteoarthritis. So we treat a lot of different patients.
What are the most common treatment areas?
Great question. So for us, it's those joints that you wear out mostly. So think of your knees, think of your hips, the joints that you're on every day, those weight-bearing joints, but we also treat every other joint in the body. So think about your shoulders, wrists, fingers. If you're doing a lot of computer work, we see a lot of people with finger issues, or your thumbs. We see ankle issues, especially in our younger demographic. So if there's a joint that's bothering you, we treat it.